If you're a health professional who helps patients complete MyPost forms, this video will provide you with the who, what, when, why, and how. Throughout this video, you will hear about POLST. POLST stands for Physician Orders for Life-Sustaining Treatment and is the national paradigm on which Michigan's MyPost program is adapted.
The POLST is a written order. That's the standard that we want to find at the scene. We cannot withhold any treatment that we're capable of giving without a legal document that authorizes us to withhold that. As we're working on the person, I think if this was me, I wouldn't want this to be happening right now if it was my mother or father, but without legal guidance, we have to do everything within our ability regardless.
MyPost stands for Michigan Physician Orders for Scope of Treatment. The bright pink MyPost form is a signed medical order regarding resuscitation, medical interventions, and artificially administered nutrition for patients for whom it would not be a surprise if they were to die within the next year. The time to complete a MyPost form is after you've had a conversation with your patient or their healthcare representative.
POST is a piece of paper without a conversation. It really looks at goals of care, treatment options, people's personal culture and desires, what they want, who they might like to speak for them. It allows for talking about the chances of recovery, the options for treatment, and what they might mean with respect to quality of life or length of life, what's important to the patient.
MyPost is designed for someone with more advanced illness, for whom it would not be surprising if they were to die within the next year. They might have advanced heart or lung disease, cancer that has spread, or they might be older and frail. MyPost is not for everyone. Most 65-year-olds, for example, are too healthy to have a MyPost. If something suddenly happened, healthy seniors would likely want everything done medically, at least until they knew more about their condition and chances for recovery. These seniors should have an advance directive. If in time they become more frail or get sicker, they or a person they appoint may want to complete a MyPost and turn their wishes into action as a medical order. And whenever a patient's health status changes, it is imperative to review and revise the MyPost form to reflect current wishes.
You can lift a burden from those you love if you complete an advance directive or a POST form and make your wishes known. If you talk to your family and they know what you want, then they can stand by what you wanted rather than deciding for you in a time of crisis.
Here's a detailed look at the MyPost form. While the form begins with a section about resuscitation, this is not the most important question for people with advanced illness and frailty. For these patients, CPR is not likely to be effective. In fact, resuscitation is successful in less than 3% of frail nursing home residents. When they understand their disease process, most patients who are in hospice or long-term nursing facilities choose the option "Do not attempt resuscitation," also known as a DNR order. Section B contains decisions about whether to return to the hospital and the intensive care unit. These decisions are very important in guiding the direction of care and making sure it matches the patient's goals. Some people wish full treatment, including life support measures in the ICU. This includes intubation and mechanical ventilation. Without a MyPost form, this is the level of treatment that would automatically be provided. Others choose limited interventions, which can include transport to the hospital to receive basic medical treatments. These patients generally wish to avoid the intensive care unit, but would want more easily addressed conditions treated, such as antibiotics for pneumonia or IV fluids for dehydration. Some choose comfort measures only. This focuses care on maximizing comfort through symptom management, so they may spend time with family. These patients prefer not to be hospitalized. Sometimes comfort measures only is referred to as allow natural death. Patients who mark the Attempt CPR box should also have an order for advanced interventions. No matter what options are chosen on a MyPost form, comfort measures are always provided.
One thing to notice about the comfort measures only order is that it indicates that the patient prefers not to be transferred to the hospital. But there is an exception to that, and that's if they can't be kept comfortable where they are. Say if their pain was out of control, or if they fell and there was a fear that they could have broken something. In that setting, it is appropriate to transport them to the hospital.
For patients whose goals of care don't fit neatly into one of these boxes, additional or clarifying orders can be written here. Section C records patient preferences for artificially administered nutrition. Food and fluids are always offered by mouth when feasible. Some patients would prefer long-term artificial nutrition by tube. Studies have shown for some patients, such as those with permanent coma, artificial nutrition by tube can lengthen their lives. However, for others, such as patients with advanced cancer or Alzheimer's dementia, it may not. Some want a feeding tube only for a defined trial period to achieve certain outcomes. Michigan law presumes that every incapacitated patient would consent to artificial nutrition unless they have indicated otherwise.
What happens to the nature of human contact? That's the most important thing that should happen in the last stages of life. And tube feedings or artificial nutrition change that nature. And we can do just as well. Some studies have shown that the survival rate is the same with well-done hand feeding. So if they're in the last stages of life, we can do just as well at getting them nutrition, and more importantly, much better at getting them human contact through hand feeding than we would through artificial nutrition.
Section D documents that the conversation occurred with the patient or their legally authorized representative, such as the patient advocate or guardian. This person is required to sign the form in Section E. Witnesses are also required by Michigan law. Witnesses may include family members and healthcare staff. Like any valid medical order, MyPost forms must be signed and dated in order for them to be valid. In Michigan, MyPost orders can be signed by a doctor, nurse practitioner, or physician assistant who work in a collaborative relationship with a physician of contract. The physician's name and contact information must be noted on the form.
No one has to have a POST form. POST is entirely voluntary. Now, an institution could have a policy that you routinely offer a POST form and that people would have an opportunity to complete one because if they're sick enough, they might want one, but you don't have to have it. You can revoke your POST form. You can have a new one written. And it's not unusual for people to have more than one POST form as their disease progresses.
Once signed, it's important that the original MyPost form remain with the patient whenever possible. However, a photocopy of the signed form is also valid. Just how does one get a MyPost conversation started?
There's some sensitivity about when to bring it up or how to bring it up, but you know, there are a lot of really good opportunities. I like to start the conversation before people are in the hospital or in a nursing home. Many people with chronic illness have thought a lot about what they want in the future and what they don't. And so to have an opportunity to really discuss it, be concrete, get down to brass tacks, you'll hear things like that from patients and their families. I thought you'd never ask.
What I've learned through my practice is that the POST really does work. It works for patients, it works for their families, it works for health professionals. Patients' wishes do seem to be better supported.